We have so
So
many patients that they'll go in and they'll fix the iliac arteries in the abdomen. They'll go and fix, let's say, the SFA, the superficial femoral artery in the thigh, or the profunda, or the popliteal behind the knee, but then they don't get any further. Even some of the doctors that may treat those three tibial vessels that are located in the calf, they still will not touch that artery loop in the foot. And so patients will come to me later and they'll say, I don't understand. I had this procedure. They say I have great blood flow. Why is it that my feet still hurt? Why do my feet still burn?
and
Why?
there's nothing else you can do, right?
Right. And then they say there's nothing else you can do. You can walk, walk, walk. And when you can't walk anymore, we'll cut it off. And
Yeah.
that's the
So
reality.
and the walking helps. That's an incredible thing to do. But it's getting to the doctors, there's so few still doing the loop. But it's growing, and I think there's hope for it. And like the research study we're doing, I'll get on, I get denials from insurance, and I will get on a peer to peer, and it's a vascular surgeon, and we get in this nice discussion. But usually the guys are reasonable, you know, and they'll say, "We'll treat the AT and the PT." Well, I'm using the same tools to go all the way down to the foot, and so at least we can get on with the treatment.
And the interesting thing for patients to know is that the doctors that are doing the artery loop when medically appropriate, especially if there is a wound that won't heal or rest pain that is waking the patient up at night because of a blockage down there in the pedal plantar loop in the foot, that artery loop in the foot, um, you don't get paid for going the extra mile. There is no reimbursement code that I'm aware of for the foot arteries. So at least if the insurance says, hey, you can treat the tibial vessels, then it's up to the doctor, these passionate doctors that will go the extra mile. And one of your counterparts, he's an interventional radiologist that's over in Venice, Florida. I won't name names. There's probably quite a few there, but there is one in particular that I got on the phone with, and this is how I discovered this, is he said, I said, how far do you go? I have a lot of patients around this area. And he says, well, we'll only go to the ankle and then we'll send them to vascular surgeons for amputation. And I said, I don't understand. He said, well, yeah, we don't get reimbursed for doing the foot, and it takes too much time. There's no money in it, and the hospital will not support us. Additionally, we had the same situation with another doctor over in Sarasota, Florida. And they said that they stopped doing limb salvage because it took too much time and there was no reimbursement for performing endovascular revascularization in the foot. And they made, I'm not kidding, I don't know. I must have this truth serum that people think they can tell me everything, things I don't want to hear. And then so the third part of it, he's like, and the hospital makes more money in less time with an amputation. And I am not kidding, because I wanted to think so much that that was not the case, that no one was really in it for the money, that they really are looking for the patient's best interest at heart. But when I've had multiple doctors tell me personally, I
Right,
just,
right.
you can't look away. You can't look away.
It's it, yeah, yeah. I sat next to a guy last night. He's from Florida, and he said the reimbursement's awful down there compared to, here I'm in rural Kentucky, and our reimbursement's actually, decent. We can do it. But that being said, I'll schedule 4, maybe 5 cases a day because they do take longer versus my colleagues in Memphis that, they can put 10 stents in a day and they get paid the same for all 10 that I get paid 5. It is definitely a passion. And you've got to have the guy that wants to do it. Cause I don't even think twice. If there's an included ATPT, my goal is to get all the way to the foot, at least get linear flow down there. But if I can get the loop, I know it's so much better. And then you see the result when you walk out of that procedure room and you just feel, and the patient tells you, my foot feels so good. It's incredible.